We are back with a critical vote that could affect your child's vaccines. The CDC Vaccine Advisory Panel set to meet later this afternoon to vote on changing the recommendation for vaccine scheduling. Our chief medical correspondent, Dr. Taryn Arul, is here with the details. Good morning.
Good morning, George. Well, this discussion yesterday really centered around the timing of the first dose in the series of hepatitis B vaccines that newborns get. And essentially the way it works is you get a dose at birth, then at 1 to 2 months, then at 6 to 18 months. And what's at odds here is around the timing of that very first newborn dose in those first 24 hours. We've been doing this in this country for about 30 years. And over that time period, we've seen a decline by about 94% in terms of kids who get infected with acute hepatitis B. We know the hepatitis B vaccine is extremely effective, over 90% effective. It is considered safe. And when you look at the numbers in this country, over the last several years, there's about 17,000 babies born every year in this country to women who have acute hepatitis B. And without the appropriate preventative measures, about 90% of those babies will develop hepatitis. What is the problem with hepatitis? Well, chronically, it ends up causing things like cirrhosis, liver failure, liver cancer, and potentially death. In fact, about 25% of infants who don't get treated will go on to die from hepatitis. So really, this is about becoming a safety net, that very first dose. And that's what public health officials are saying, that, you know, even though we screen pregnant women for hepatitis, we may miss some of those women who don't get prenatal care. Some of those women may have false negative results. They may never get their test results back. They may never get treated. They may get infected with hepatitis B between the time they get tested and the time they deliver. So there are babies that are going to be vulnerable. In addition, babies can get infected from caregivers. So in those first few months, if a caregiver has hepatitis B, they can pass it on to the baby. Many caregivers or many individuals don't know they have it. In fact, half of Americans who have hepatitis B are asymptomatic, have no idea that they have it. And so really, you know, this is a very important discussion, and I think concerning for a lot of individuals. 117 countries internationally do give the hepatitis B vaccine at birth. And again, as we were talking about in the break, there's no new data or research that is really pushing this forward. It is a re-examination of old research and looking at what other countries do.
So after listening to you, it's hard to imagine this is even a debate, but it is right now. The vote has been put off twice. There seems to be some kind of a tussle going on inside the committee.
Yes, I think there's a lot of confusion both inside the committee, for people listening, for people who were there yesterday. And it's a very difficult time, I think, for parents, for physicians to really know where to go to get the appropriate information. And so at this point in time, the American Academy of Pediatrics, for example, is still promoting the idea that we should get that birth vaccine. That is very important. But I think the important thing for parents, George, is to have a conversation with your pediatrician. Ask these questions, talk about the risks and benefits. Ultimately, the ACIP makes recommendations to the CDC. The CDC sets the policy, but it's really the states that have the ability to kind of push this forward, and insurance companies will follow. Unfortunately, or fortunately, sometimes what the ACIP recommendations are.
Thanks very much.
Yeah.